In this video, we are from Sgd B5. We would like to explain our student project, which is the risk factor aspect of the scenario 5. So this is our group members, and I would like to explain first from the background. So the most prevalent type of cardiovascular condition and the main cause of death worldwide is coronary artery disease, which is CAD. As it mostly affects the adult human population, developing countries are the highest prevalence rates. So on the etiology of CAD and its risk factors, including gender, age, hypertension, serum cholesterol level, and smoking, and also atherosclerosis is the one of main etiological factors that contributes to the beginning of CAD among all the risk factors. So the recent attempts to unravel the relationship between CAD and the various genetic loci implicated in the etiology of atherosclerosis have been used genome-wide association analysis. So according to the recent research, apolipoprotein B level in the blood may be a significant risk factor for the ischemic heart disease, which is IHD. So however, there is a lack of information and also disagreement about the usefulness of testing ApoA1 and also ApoB levels in determining IHD risk. So searching for the last literature about the topic may help to deepen our knowledge, but have to be critical in searching and choosing the literature. So critical appraisal in the literature must be done, as it allows us to use the evidence of research reliably, and critical appraisal help us to establish whether the evidence of the research is valid, and it also can be used to inform the medical decision in apolipoprotein A1 and B as risk factor to the severity of CAD and its predictive ability of ischemic heart disease or IHD.
Good morning, doctors and friends. My name is Tiara with student number 105. So for the first question, identify what type of question of the above scenario. This scenario is discussing to find evidence regarding risk factor association to the severity of CAD and also determine the better predictors for ischemic heart disease. Based on PICO, this is an indicator type question, which is to determine the risk factor. As this is an analytic study, this scenario utilizes relationship questions. Relationship questions aims to study causal relationship, association, or interactions between variables. Thank you.
Good afternoon, doctor. My name is Vanessa L, number 121. Based on question number 2, listed below are PICO based on the article and clinical research questions made based on it. The PICO, P is for patient or problem or population. The keyword is patient with coronary artery disease or CAD. The synonyms are patient with ischemic heart disease and patients with coronary heart disease. The I for intervention or index or indicator is apolipoprotein A1. The C for comparator or control is apolipoprotein B. O for outcome are association between risk factors to the severity of CAD and the best risk factor predictors of CAD. Clinical research questions made based on the PICO is apolipoprotein B a better predictor of CAD risk factors than apolipoprotein A1? And the second question is what is the association between apolipoprotein B and apolipoprotein A1 as predictors for CAD and the severity of CAD incidence?
Hello, doctor and friends. My name is Nuptusa Sotashodapte, student number 124, and I will continue with mentioning the clinical research question for this student project. So the first one is apolipoprotein B a better predictor of CAD risk factors than apolipoprotein A1? And the second one is what is the association between apolipoprotein B and apolipoprotein A1 as predictors for CAD and the severity of CAD incidence? Thank you.
Hello, doctor and friends. My name is Donna Uisidauruk, student number 165. We try to find the best article to answer the clinical research questions based on the PICO. We use the PubMed page, one of the largest and user-friendly online medical journal database from Medline, to search for related journals or articles. This is the process of searching articles on the PubMed page, and these are 4 articles that fit the PICO standard, published within the last 5 years and can be accessed freely in full text. Thank you.
Hello, my name is Putri, and I would like to continue what Donna had already said about article research. So these 4 articles that Donna mentioned then undergo a process of critical review in order to answer the clinical questions that had been compiled. After that, the authors picked the 4th article entitled The Relation Between ApoB and ApoA1 Ratio and the Severity of Coronary Artery Disease in Patients with Acute Coronary Syndrome. And the selection of this article is based on several reasons, which are considered to have the highest level of VIA, or validity, importance, and applicable. As well as the fourth article is also related to the questions asked. So here are the flowchart of what we have done to critically reviewing the article. So there are 4 articles within the last 5 years that can be accessed online freely in full text form, and then after that we do a little bit of critical review, and finally the best one is chosen for further explanations. The title is The Relation Between ApoB / ApoA1 Ratio and the Severity of Coronary Artery Disease in Patients with Acute Coronary Syndrome. So that's all I can say about the article research. Thank you.
Hello, my name is Nana Pramesti with student number 167. Now I want to explain the validity of this journal. The journal title represents the correlation between the ApoB and ApoA1 ratio with the severity of coronary artery disease in patients with the acute coronary syndrome. The first is the abstract. The journal the abstract was very impressively by the authors and include the background, methodology, result, discussion, and conclusion in a clear way. With the total words in the abstract are 124 words, which mean fits the rule of a maximum of 25 words. And the abstract represented 3 keywords. The first is ApoB and ApoA1 ratio, coronary artery disease, and acute coronary syndrome. So in the abstract, we can find the brief and concise information to all readers about the research purpose and main findings. And the second is background. In the background, the authors explain more detail about what previous knowledge has been known by all of us, yet the authors found a gap in knowledge in LDL structure, especially apolipoprotein B, considered a better predictor than LDL total or cholesterol, because apolipoprotein B is a major protein constituent of LDL. Starting from that, the authors make a research formula question in line with the PICO formula to conduct the research. And the validity of the methodology in this journal is used a cross-sectional observational study which recruited 90 subjects who were worth coronary angiography. There are exclusion criteria, and also this study has been conducted with informed consent from all patients and was approved by the ethical committee. And this study does not get any funding from other institutes and has no competing interest. Subjects were categorized into 3 groups. Each group contained 30 patients according to their acute coronary syndrome presentation from STEMI and unstable angina. After that, subjects were subdivided according to Genshin score. And all subjects before and after this study all checked at the time of admission by history taking, clinical examination, and also contribute Sgd laboratory investigation and cardiac enzyme, electroponin, and CKMB. Analysis the study using SPSS version 22 with the test T-square, F-test, and percent test to show the strong association between a quantitative variable, and to know sensitivity and specificity for possible cutoff using ROC curves reuse. Thank you.
Hello, my name is Putabina Masudana Radika, student number 239. I will explain about the next slide. So, is the sample representative or inference to the target population? Actually, there are more important aspects need to be considered. That is, small number of study population in this research, and the full lipid profile was not taken to compare the predictive power of ApoB and ApoB or ApoA1 ratios with LDL and triglycerides in detection of severe coronary artery disease. Next is all the sample subjects recruited in the same phase of disease. So yes, all patients recruited at the same time and same phase of the disease. But on the other side, failed to exclude patients who are already on statin therapy before presentation with ACS because it can make bias in result. Next, was patient follow-up sufficiently long and complete? So likewise, no follow-up for the patient with higher level of ApoB and ApoB or ApoA ratio in order to detect early and late cardiovascular event. So that's all. Thank you.
Hello, Dr. and friends. My name is Vindu Valentin with journal number 086. This journal is important to find the relationship between the APOB and APOA1 ratio and the severity of CAD. Results of the APOB and APOA1 ratio are significantly related to GS, with p-value less than 0.001, and high GS value is associated with a high APOB and APOA1 ratio, with the best cutoff value at 0.8, sensitivity of 90%, and specificity of 70%. Thank you.
Hello everyone, my name is Dia Ayuswitari, student number 173. For the applicability aspect of this journal, it was found that APOB was an independent risk predictor of CAD severity in patients with ACS. The results of this journal research can be applied to the majority of the public because it uses methods that are already used by Indonesian clinicians or physicians, such as 12-lead ECG and laboratory tests in the form of cardiac enzymes, including troponin and CKMB. Also serum serotonin levels and serum APA1 levels and APOB. Lastly, it is crucial to remember that each procedure must have the patient's informed consent before it is finally carried out.
Hello, Doctor and friends. My name is Shantri with my student number 142. According to the study discussed on the few points before, it is proven that ApoB or ApoA1 level is found significantly high in CAD patients with high Gensini score. The more severe the CAD, the higher the ApoB or APO1 levels. But is that valid and relevant enough to be applied in real life? In my view, no. Evidence alone is not sufficient to determine whether these parameters are really better to screen the risk of CAD. Clinical expertise, also patients' view and values needs to be considered. The problem is that people who stay away from well-known risk factors such as smoking or drinking habits and those who live and eat healthily mostly believes that health screenings are not necessary for them, as they are perfectly fit and there is no sign of abnormalities. This is even more troubling with the fact that health screenings can be costly, especially as not every lipid profile testing includes ApoB and ApoA1 parameters. So, if we want to specifically predict CAD from the ApoB or ApoA1, additional testing, also additional cost might be needed. Hence, health promotion needs to be intensified and the importance of ApoB and ApoA1 as parameters and lipid profile testing should be emphasized even more for this case to become more applicable. Thank you.
My name is Ceko Destra Plantepemayon with student number 252. After finding the best evidence, the next step is to decide the application in patient care through integration with clinical expertise and patient value. Every patient has their own individual value and preference. Patient preference such as religious, spiritual beliefs, social, cultural, personal thought, clinical experience, and previous knowledge must be considered in the process of making clinical decision per patient. Furthermore, patient characteristics such as gender, age, ethnicity, race, and socio-economic status also affect patient decision, health, and well-being. Based on research in the journal, the study did not assess race, ethnicity, nutritional, education, and socio-economic status of the patient. Every country has different dominant race and ethnicity. For example, in Indonesia, there are around 250 ethnicities and Javanese as the dominant ethnicity. Socioeconomic status also affects the clinical making process. Majority of patients with low socioeconomic status have less access to health care. They rarely check up on their condition to primary care physician. Geographical accessibility to healthcare or primary physician also needed to be considered. In Indonesia, geographical barriers are dominantly affecting the accessibility of health services. The primary healthcare ratio is still not evenly distributed and still focused on a few provinces only. In this study, the research did not clarify specifically where the study conducted and did not assess socioeconomic status of the subject. Patient education could also influence nutritional status. Individuals with higher education and socioeconomic status are more likely to maintain healthy and adequate nutrition choices because of accessibility to fresh whole food. Education status in Indonesia still varies in every province. In the research, education and nutrition status was not assessed by the researcher. This research also doesn't consider other factors such as patient lifestyle behavior that could affect the outcome. For example, cigarette smoking and physical inactivity are associated with cardiovascular disease. In addition, differences in policy and healthcare system should also be considered in the health decision-making process. In this study, subject characteristics are not assessed and clarified specifically. This condition could affect the applicability aspect of the evidence that was found in this study in patient care. Thank you. Next.
Okay, so my name is Ada Prabudi Sakti with student number of 253 and I'll explain about the conclusions. So CAD is the most common form of cardiovascular disorder and a leading cause of mortality occurring worldwide. Elevated plasma concentration of apolipoprotein or APOB may be considered as an important risk factor for ischemic heart disease. As for this article, aspect need to be considered that the small number of study population in this research, no exclusion for patients who are already on statin therapy before presentation with ACS because it can make biased result, and no follow-up for the patients with higher level of APOB and APOB or APO1 ratio in order to detect early and late cardiovascular events. It can be said that this journal is important to find the relationship between the APOB or APOA1 ratio and the severity of CAD. High GS value is associated with a high APOB or APOA1 ratio. Moreover, it is crucial to remember that each procedure must have the patient's informed consent before it is finally carried out. That's all for our presentation. Thank you for your attention.